Welcome to Baptist Medical News Network. I'm Rhonda McRae. Thank you for joining us for our webcast today. Our topic is getting ready for allergy season. Spring is right around the corner, and people with seasonal allergies are wanting to know what they can do to make it through the season with the least amount of symptoms and discomfort. So here to help us today, we have Dr. Ashley Pullen. Dr. Pullen, thank you for joining us today. Dr. Pullen is with Baptist Medical Clinic Family Medicine in Madison. So we're very interested to hear what you have to say today, Dr. Pullen. Thank you so much.
Thank you for having me.
Okay. Well, let's just start with the basics. Okay. What are seasonal allergies? How does that work within your body?
Seasonal allergies are a response that we have to allergens in the outdoor as well as in our indoor areas. And it happens different times of the year. In the southeast, it happens most of the year because we have pollens all the time. But mostly people start to have symptoms that will resolve usually with over-the-counter medications.
Okay, well that's kind of one of the questions I was going to get into. Is there any way, before we get into like the duration and treatment and all like that, is there anything that a person can do, since we do have the pollens pretty much year round, is there anything a person can do to like reduce their risk of having that reaction?
Right. Things that you can do for the outdoor allergens, if you're going to be one that works in the yard a lot, mows your yard, that sort of thing, then you'd like to wear a mask.
Okay.
And then, of course, if you're outdoors a good bit, then you'd like to shower to remove allergens before you go to bed at night.
Okay.
Remove the clothes that you've been outdoors immediately after working in the outdoors. Okay. Air filters inside your home will also help to remove the outdoor pollens and things from the air that's brought inside.
Okay.
For indoor allergens, things like plastic covers for your pillows, plastic covers for your mattress, removing carpet if that's an option for you. If you have an indoor pet, if it's difficult, but sometimes putting that indoor pet outdoors, or using room air filters, the little portable things for pet allergens.
Okay.
If you have upholstered furniture, removing that if that's an option. And then if you're one who needs drapes and you have really bad allergies, then removing drapes and other upholstered things that hold on to indoor allergens.
So those fabrics can trap.
Exactly.
Okay, I see. And when you talk about the masks, like when you're mowing the yard and that kind of thing, is that just the little...
Just the little white mask that you can buy at...
Like a Home
Ace
Depot
Hardware
or
Home
something.
Depot or something of that nature.
Okay, so I guess that's a little free advertising for Home Depot and Ace Hardware. But that's good to know that there are things we can do that can reduce those risks.
Right. Exactly.
All right, well, let's move on. People probably know the common symptoms, but what are the most common symptoms?
The most common symptoms would be nasal drainage, mostly clear, post-nasal drip, we call when the sinuses are draining down the throat, a nighttime cough that you can't seem to get rid of, excuse me, nasal congestion, difficulty breathing, itchy, red, watery eyes, things of that sort.
Okay, probably people who are watching this are pretty familiar with the symptoms, but here's what I know everyone is going to be so interested to hear. What are some good strategies for relief, for self-help measures for the symptom relief?
Exactly.
Okay.
Nasal saline.
Okay.
Or saline washes. People have heard of neti pots, just generic nasal saline spray. You can use that daily. You can use it especially after allergen exposure. So if you've been working in the yard, to clean your nasal passages with nasal saline is a good idea.
Okay.
Also over-the-counter antihistamines. Now there are two different kinds. You have the ones that are sedating, as in Benadryl and other sedating antihistamines that can cause a lot of drowsiness. So you have to avoid driving. Sometimes it's caution in the elderly patient who may get so drowsy they fall. They're risk of falling. There are now over-the-counter non-sedating antihistamines that used to be prescription. So Zyrtec, Claritin, things of that nature would be a non-sedating antihistamine that you can take daily. It's safe for every patient. Decongestants are usually in a combination with a lot of our allergy medications, but patients with hypertension and men with benign prostatic hypertrophy should avoid decongestants because they can raise the blood pressure in a person who has hypertension, and then they can make the symptoms of BPH worse for the men who have that problem.
Okay.
So decongestants should be avoided.
Okay.
There are also over-the-counter decongestant nasal sprays, Afrin being one of those, that you can use for short-term relief that gives you immediate relief once used, but if you use it longer than 3 days, it becomes an addictive medication and your nose gets rebound stuffiness.
Okay.
So you have to avoid that for longer than 3 days of use. There are prescription medicines, but I think we can get into that later.
We'll get into that because we want to talk about, before we get there, more when you know it's time to see the doctor. So let's just recap the home. So the nasal salines, safe for everybody. It's just a saline spray that used to basically clean, and that's a good preventive measure too.
Exactly.
Okay. And then the over-the-counter antihistamines,
correct,
and then over-the-counter decongestants. Being careful with those.
Right.
Okay. All right.
And if you're on a list of medications, you know, like some people are, it's always a good idea to check with your physician first.
Well, that's kind of one of the things I want to talk about. And you've kind of gone into this, but over-the-counter drugs, it's good to know, even though you can buy them without a prescription, they can interact with drugs you're taking already.
Correct.
So talk with your physician about those.
Right. If you're on a list of medications, it's a good idea.
Okay.
To talk with your physician first.
And are there any sort of known, you talked about the benign prostate hyperplasia, but are there any other sort of...
Well, patients with hypertension.
Hypertension.
Should definitely avoid over-the-counter decongestants.
Decongestants.
And histamines are safe.
Okay. All right. Well, any other sort of common reactions to these over-the-counter drugs we need to mention?
Not typically. Okay. Those are the most common.
Okay. All right. Well, and you kind of hinted on this, but now we're going to get into when a person might need to think about coming to see you, maybe, Dr. Pullen. But here's the first question. Without treatment, will most allergy symptoms clear up on their own?
If the allergen is removed, the symptoms will clear up on their own.
Okay.
Now, with outdoor allergens, it's hard to remove unless you're just going to stay indoors 24/7.
Okay.
And that's difficult for most people.
Okay.
So, but if you can remove the allergen, the symptoms will get better.
Okay, all right. Otherwise, it's just wait for the pollens to die down and good luck.
Or the rain.
Or the rain. All right, so left untreated, the symptoms will last until the allergens go away, really.
Right,
so
or you take an over-the-counter antihistamine and hopefully find some relief.
All right, so now we're getting into it. If a person is having the allergic reaction, and when should they go see a doctor? At what point do they need to get medical attention? The self-help measures aren't doing the trick, but how do they know?
Well, if the symptoms continue for more than 5 to 7 days and you've tried over-the-counter medications, then definitely you should try to seek medical attention.
Okay.
There are other measures that we can take to try to make you feel better.
Okay.
If you develop fever, then obviously you should see your physician, because with allergies, you can develop a sinusitis or an infection within the sinuses.
Okay.
And that requires antibiotic treatment.
Okay.
So if you have fever or lots of facial pain, tooth pain, headaches, that sort of thing, and symptoms that just won't get better, then you should see your physician.
Okay, so things will not get better on their own if you reach the point when you have fever, facial pain, toothaches, those kinds of things. Your self-help measures at that point no longer help you.
Right.
Is that right? Okay.
Exactly.
All right. Well, you know, some people like to kind of tough things out, so they've already got the fever and they're thinking, I'm not going to the doctor. It's just the allergies. I'm not going. Can they hurt themselves by trying to tough it out at that point? I mean, can that be dangerous, I guess, really?
It could potentially be dangerous. For the most part, it doesn't become life-threatening.
Right.
And will eventually possibly get better. You know, if you've developed a virus or something that has caused your symptoms. But,
yeah. But but toughing it out just means the
long days of agony.
Feeling terrible.
Exactly.
Okay, well, this is great information. Thank you so much for helping us today. I know that what we've talked about is going to give people great ideas to make it through the spring. So thank you so much,
You're
Dr.
welcome.
Pullen. We appreciate it.
You're welcome.
And I just want to let our viewers know, if during allergy season you develop those symptoms and you do need treatment, we've got Baptist Medical Clinic, family medicine locations throughout the metro area with physicians who can help you with the prescriptions that you may need. To find out which clinic is the most convenient to you, you can go online to www.mbhs.org/clinic, and there will be a listing of the clinics there, the hours. There's a map that shows you where they're located. So if that's something that you need, be sure and go online and find a clinic and get help. Thank you again, Dr. Pullen.
You're welcome.
And we hope that you will join us next month for our next webcast. We hope to see you then. Thank you.